Yeah, look, and I think the simple point of view is that fine motor issues, auditory issues, visual issues don't necessarily develop in isolation. The
Mm,
one way of looking at it is that a vision problem is a developmental problem just viewed from the visual system. That
hmm
that we're seeing the fallout from an overall issue with development. I'm seeing it in the visual system. The speech therapist is going to be seeing it in language and maybe auditory. The occupational therapist is going to be looking at it from a behavior and fine motor control sort of point of view. So, as soon as you move away from typical development, then you're more likely to find, skews in development no matter what kind of practitioner you are. So we all have a role to play, making sure that that child is getting the best opportunity, the best support possible.
do you have cases where like kids are maybe like they have trouble articulating the issues that they have, like maybe because they might come from a background where the home language they're using is not English, or there might be some other impediments to actually communicating. Is that a challenge for you to deal with sometimes?
It means you have to work differently. I guess my experience has been that we've got experience testing people from 6 months old. I've done a lot of work in group homes where you're going into people with special needs who are non-verbal, non-communicative, and we certainly see a lot of those sort of patients in the practice. And so you develop a suite of tools that allow
Mm,
you, give you insight into how a person's using their visual system, what their prescription is, and their ocular health, where you're not just relying on their feedback verbally. And so, we talk about two different kinds of tests. We've got objective tests, and that's stuff that we can
mm,
observe about the visual system. And then you've got subjective tests where
mm,
the person's able to give you a response as a
mm,
confirmation. And on pretty much every patient, regardless of their developmental level, so our regular general practice kind of patients, I'm using objective tests and subjective tests all the time. And so
mm.
that leaning on objective tests really means that you've got the skills and equipment to be able to work with someone who may not have the verbal skills either through cultural reasons or developmental reasons, medical reasons. So
Mm.
there's a lot that you can still do without them needing to be able to read English, read a letter chart, or even respond.
Yeah, it's really interesting that comment that you do objective tests and subjective tests. Like I was watching a video recently where an optometrist was saying that we don't perceive the world with our eyes, we perceive it with our brain. The eyes are just sort of like the one of the tools that our brain uses, but it's actually everyone's experience of perceiving the world is different because of that's where it happens.
Based on your experience. And look, your brain's just a big predicting machine. It's a big probability machine. What it's trying
Mm,
to work out is what's going to happen in the next tenth of a second.
mm,
And it's basing it on your experience and what information is available. And what it needs to do is it needs to filter out the most important bits of information because there's so much noise in the environment. And so your brain learns to try and pick on the bits of information that are most likely about
mm.
to tell you about what's about to happen. And what I like to say to patients is, you can't be processing the bus right when it's there. You need to know that it's coming before it gets to you, otherwise you get hit by it.